Welcome back to Medicine Deconstructed. I'm your host, Dr. J. Rutland. So we're still in the middle of a pandemic. And now people are concerned about another virus called monkeypox. Let's talk monkeypox, what it is, how to recognize it, and manage it on today's episode. As of this date, May 24th, there have been one confirmed case and 6 presumptive cases of monkeypox in the United States. It's not a lot. There have been 1,200 cases or so in the Democratic Republic of Congo, 46 cases in Nigeria, followed by 25 cases in Cameroon up to this point. Again, only 1 to 5 cases confirmed in the United States, which is why no one is tripping just yet. There are 92 cases of monkeypox across the non-endemic countries who report to the European Union. As I have mentioned, there are many types of infectious organisms. Remember, there are bacteria, fungi, viruses, and parasites. Check out those shorts. Well, monkeypox is a virus. It's a zoonotic disease, meaning it is transmitted from animals to humans. In my eyes, both monkeys and humans are mammals, and our organs function the same, so it doesn't surprise me that a virus in monkeys can infect Homo sapiens, although the virus is most commonly found in rodents. Viruses are organized in families. And like camelpox, vaccinia virus, cowpox, and smallpox, monkeypox is in the family Poxviridae, Chordopoxviridae subfamily, and Orthopox virus genus, and it's one of the 5 orthopox species that are pathogenic to humans. The variola virus, the causative agent of smallpox, which is now eradicated in nature, caused many deaths throughout the history of our world. The last known cases were in the late 1970s, and smallpox was eradicated again in 1980. In 1796, the English doctor Edward Jenner, not related to Caitlin, noticed that milkmaids who had been infected with cowpox did not get smallpox. This led to the production of the world's first smallpox vaccine. In fact, the word vaccine is derived from the Latin word for cow. I say this to inform you a vaccine for monkeypox already exists. It's a smallpox vaccine. And the United States has 100 million doses already available, with efforts to ramp up production if the threat becomes serious. The vaccine against smallpox and monkeypox is called MVA-BN, or Jynneos in the United States, but Imvanex in the European Union. It is a weakened smallpox virus that cannot replicate. When the immune system is exposed to virus, remember, antibodies and T cells recognize the pathogen and learn how to clear it from the body. Monkeypox presents in individuals with an unexplained rash with possible headache, fever, swollen lymph nodes, myalgia, muscle pains, back pain, or profound weakness. Remember, the disease is endemic to Central and West Africa. So if an individual has traveled through this part of the world recently and demonstrates any of the symptoms listed previously, pay attention. The virus can be transmitted from animal to human and human to human through broken skin, mucous membranes, and the respiratory tract. The incubation period is 5 to 13 days. But it's been as long as 17, so people might not get sick for 2 weeks. Rash usually follows fever about 1 to 3 days, with lesions appearing simultaneously and evolving from macules to papules, vesicles, and pustules to crusts. Patients can present with ocular findings, nausea and vomiting, as well as respiratory findings. Case fatality is 1 to 11%, depending on where you are receiving care. Once the virus infects, cell necrosis and vasculitis ensue as a result of local replication. The virus then replicates in regional lymph nodes and the bloodstream, leading to primary viremia. The virus then multiplies in the spleen, liver, bone marrow, and other reticuloendothelial organs. Then a secondary viremia begins, which can lead to seeding of other organs. The virus is best diagnosed via PCR, or polymerase chain reaction. Protection against this infection is through the smallpox vaccine, which is 85% effective. Since we stopped giving the smallpox vaccine in 1980, cases have risen. That sucks, and we should probably reconsider, especially in the endemic areas. There are some antivirals that have demonstrated some activity. One is called cidofovir, which inhibits viral DNA synthesis. It's a nucleotide analog of cytosine. Another drug is actually FDA approved for the treatment of smallpox is tecovirimat. Monkeypox is a double-stranded DNA virus that is enveloped. This drug, tecovirimat, inhibits a protein called P37 from interacting with intracellular transport components necessary for the production of enveloped virus, basically inhibiting the spread of virus by inhibiting extracellular viral forms, slowing down the disease and allowing the immune system to catch up and clear that shit. Thanks for joining today's episode. I hope you learned a little more about monkeypox. I hope you understand monkeypox is not a huge threat yet, but I'd be lying to you if I said we are not prepared to handle potential outbreaks. We have treatment strategies that include both oral products and vaccines to help us deal with a potential problem. Remember, I'm here to arm you with information. I'm going to see you next time for some more ammunition. Take care.